Welcome. I'm Jim Hermiller, one of the co-directors for the SCAI 2012 scientific sessions here in Las Vegas. And Kenny Rosenfield is co-chair as well, and we're really excited about this year's program. And I think this year, particularly Friday's, going to be exceptional. And Kenny, could you just give us some highlights?
Sure, Jim. So Friday is really an exciting day. We are trying some new things at SCAI annual meeting. And quite frankly, we're trying to prepare the interventional cardiology world for the future, what we'll face. So in the middle of the morning, we start off with a Hermiller lecture by Dr. Ralph Brindis. And Ralph's going to talk to us about threats, challenges, and opportunities for interventional cardiologists, how to deal with what we're going to be facing over the next few years in terms of changes in payment model and so on and so forth. And that's going to be followed by a lecture delivered by Dr. Elliot Fisher, who's the gentleman that coined the term accountable care organizations. And Elliot is going to talk to us about how we need to be agents of change. The title of his talk is Why Interventional Cardiology Needs to Be Change Leaders. And I think that the point of this is to challenge us to step up to the plate, to do the right thing every time for every patient, and to keep an eye on each other and help each other get through the challenges that we face to optimize care for our patients. The rest of Friday is going to be exciting just as well. After Elliot's discussion, there will be a series of short talks about things that your society has done, the SCAI has done, to help us achieve high-quality care for our patients. And Kaylin Ho will be demonstrating the use of an appropriate use tool that you can use in your laboratory prior to actually doing an intervention to help guide you and tell you how you will be scored, if you will. It's going to be an exciting session. So I really want everybody to encourage everybody to attend this town hall meeting in the middle of the day on Friday. You want to talk about some of the other things on Friday?
I would just first agree that this is going to be an incredibly innovative session. Nobody can miss it. So let's just talk a little bit about the coronary tract. It's going to start off the day with really digging into bifurcations. And I think everybody always has questions about how do I treat bifurcation? What's the latest way to do it? And so I think that'll be a very practical session. We're going to then talk in the afternoon about what are the challenges of stenting today, a little bit about new technology, but more of how do you optimally treat your patient with contemporary stents. And then I think to end the day, there's going to be a great session on clots, shock, and STEMI. So we're going to talk about STEMI, hemodynamic support. It'll be just a terrific session as well. How about on the PV front?
So on the peripheral vascular front, we also have an exciting day. It starts out with a session on complications, and everybody loves complications. We like to see judged complications. How did you get out of that one, man? So then we're going to have a session on the future of peripheral vascular disease. We talk about cell-based therapies, about new devices, renal denervation, what's the role of registries and how will that direct our therapies. And then there's a whole session on vascular access, which will be, I think, exciting. Everybody's talking about that, more and more radials. Also, how do you deal with the large vessel access that TAVI and other technologies are bringing down the pike. And finally, after the town hall meeting, which I'll reiterate, everybody's got to go to that session. There will be an opportunity, by the way, to ask questions during that session, so I want to reemphasize that. But towards the end of the day, we're trying something fun, which is try to end the sessions with a little bit of work with appropriate use criteria for peripheral vascular disease. We're going to have a few little talks about what should be the basis for appropriate use criteria in the peripheral vascular arena, and then we're going to do a little modified Delphi session with the audience. So the intent of this is to get audience participation, to have you step up to the plate and tell us what you think. So we're looking forward to it. This is going to be really fun.
There'll be just some sessions on structural on Friday too, including pretty much everything you'd want to do in the left atrium, from PFOs, ASDs to left atrial ablative therapy. So that'll be a great session. Then at the end of the day, you can't miss it if you're interested in structural. We're going to have the best cases and best saves of the year. So it should be a great session.
So this is an incredibly packed program, Jim. I don't know how you did it, but
Kenny did it.
We both did it. But I do want to say that there's no possible way that you can catch all of the incredibly exciting stuff that's happening at this meeting. But there is one way, and that is if you go purchase the on-demand feature for $100, you can get access to every single CME event that's happening during this session, and we would encourage you to do that. The on-demand event, on-demand feature will be available during the session, so you can actually say, geez, I missed that session over there, I really wanted to know what happened there. You can go online immediately and capture that. So it's a nice feature that the Society's added this year.
Yeah, it is a way to catch everything that's been said, and we really look forward to seeing you on Friday. It's going to be an exciting day.